Good day, everyone. I'm happy to be here. Vaccine hesitancy is an indecision. Sometimes most people accept some vaccine and they also delay some. Some refuse to take at all. Now, what triggers this vaccine hesitancy? Most of the time, it has to do with misinformation. People misleading the community members, citizens. Example, like what happened many years ago in the UK when it was said that MMR causes autism. And after many decades, people still believe that that is true. Meanwhile, it's false. MMR does not cause autism. Disinformation can also cause vaccine hesitancy. False information. People purposely do that just to mislead people. Fake news, like when I remember when there was Ebola in Nigeria, people said say you can drink water and so, those things are, very fake news, rumors and so on. These are things that causes vaccine hesitancy. The recent one going on in Africa is this HPV vaccine, when almost all Africans are saying the Westerners are bringing in things to make our girls not to be fertile, not be able to reproduce or give birth to children. Me, I want to be a grandmother. Me, I want to be a grandfather. These are things that are causing vaccine hesitancy. And it's very misleading, decreases vaccine confidence, and there is fear about safety, anxiety, and people refusing to take their vaccines, both for the adults and also for children. Now, what are the challenges we are facing in Central Africa? I know that Central Africa, most of the countries there, they are having conflict, war zones, and so on. So I will use what happens in the northern part of Nigeria as a case study. Now, my colleagues in the north, Boronu, for example, if they want to move into the community, they go in and are very strategic about it. They move in with GPS, they survey, they go in with military personnel. Sometimes they have to fly with a jet plane, get there, do whatever they want to do quickly and move away from the community. I have a colleague that did a WHO fellowship program in Jos. What she did because of kidnapping was to take the community unawares. When she's about to arrive, nobody knows she's about to arrive. She will quickly do what she wants to do, administer vaccine to children and take off. That's the best way to go about it. You don't inform them ahead of time so that they don't go there waiting for you to get kidnapped and maybe cause harm for your colleagues. Another thing to do is to build trust with the community. Overcoming misinformation. You have to have principles for messaging. Your message must be short. You must be honest for people to be able to trust you. You have to apply empathy. Listen to them first. Try to find out why are they hesitant. Why is the vaccine demand and uptake low? Listen to them. When you find out what the problem is, then you address, offer solution. Probably it may be something like there was a role play we just did last week. We had to listen to the community to find out what was wrong. And after we heard what they mentioned, we started addressing it slowly. Sometimes you can apply storytelling. Storytelling is very good, especially when you want to have a positive change. Imagine telling a story of a lady that had an opportunity to have maybe take this cervical, this HPV vaccine many years ago, and she didn't do that. Eventually came down with cervical cancer. Now she's regretting. If she had taken this vaccine, probably she wouldn't have gotten that diseases and so on. So if you start, get to their emotion, make them sometimes feel guilty, make them to understand the reason why they should have this vaccine, or maybe rotavirus or pneumococcal. I know that sometime about 10 years ago, we did have pneumococcal in some parts of Africa. And people were abusing antibiotics and so on. Some children were even dying as a result of people not knowing the dosage to use. Use storytelling to effect positive change. Tell them the importance of taking pneumococcal vaccine, the importance of taking rotavirus. Your child will not have diarrhea, will not die. Even cholera vaccine, just give them. Make the picture to look so good. And your story must be authentic. Don't just go and cook up a story. It must be something that is real, something, you must be able to say, this happened to so and so. Like when I was in the field, I used my children, my second daughter had she had diarrhea 2016. And what helped her was because she took rotavirus vaccine. If not, I would have lost her. So your story must be real, must be authentic. You don't have to go cook up stories just to make the community to change their ideas or what they believe in. Another thing is your communication strategy must be very good. It must be something that every other person can understand. If it's a community that doesn't understand English, use the local language. Find an interpreter to interpret, the messages, and for them to understand whatever you're telling them. Now, successful community engagement. Sensitization is very good, especially when you do like maybe a community has maybe community gathering, maybe during Salah period, or maybe they have Children's Day and parents will be there, or PTA. That's a very good time to get the attention of parents if you want to get their consent to give their children immunization. Talk to parents, make them understand the importance of vaccination, that vaccine is a life course, because most people think that the vaccine ends when their child is 2 years. No, vaccine is a life course. Even adults, old age, you still need to be vaccinated if there is a need. Going to community gatherings, marketplaces, motor parks, sports areas are very good. I remember during COVID, when I went to get my COVID vaccine, I saw some athletes, footballers. They came to take theirs, and I asked them, "What made you to change your idea about COVID-19 vaccine?" I said, we had someone come to the field to talk to us about it. And we even heard we can't travel without our vaccine certificate, COVID-19 vaccine. And I said, that's good. So you're aware of it? He said, yes. So go to the communities, talk to them about it. And when you are doing that, you have to build public trust. And you have to be the positive change you want to see in the community. You can't be telling people to go and vaccinate their children when you don't even do that. When it comes to cultural norms, like we know that some parts of Africa, a woman does not have to take decision, the head of the family, which is the man. I know in Ghana, there was this program that they do, they had to use the men. So now the men were not the one, will I call them gossipers, getting the attention of the community members, helping us to, spread the information about how wonderful vaccine is. So that's the way. There's also traditional media, the town criers, in a way, maybe radio and so on, in a situation where maybe they don't have social media like Facebook, WhatsApp, and so on. You make use of the local media. I know that collaboration helps. What has helped Nigerians is learning from other African countries. What worked in Ghana, what worked in Chad, they apply it in Nigeria. Attending webinars too. Attending trainings, like throughout last week, I was in annual African vaccinology course for a week. And we came from different parts of Africa, and some of us were also living outside Africa. So they all brought in their ideas. The discussion was great. Role play was good. We learned a lot. So collaboration is key, because if you collaborate, you go far. But if you don't, you won't go far. Thank you.